Alzheimer's disease is more incredibly prevalent and well known than it was 100 years ago. The disease is classified in a subtype grouping of other forms of dementia that alter the patient's abilities to carry out normal activities of daily living, ADLs. Dementia is a general term that refers to progressive degenerative brain dysfunction, including deterioration in memory, concentration, language skills, visuospatial skills, and reasoning. Mock 2014, page 377. Dr. Alois Alzheimer, a psychiatrist and neuropathologist from Germany, was the first physician to give a description of the disease in 1906 during a conference lecture of what he observed in one of his female patients. His ideas, not immediately embraced, were not systematically studied until the 1970s. Mock 2014, page 377. More than 100 years later, many of his clinical observations and findings remain pivotal in the studies of Alzheimer's disease today. The current statistics show startling information. Currently, there is an estimated 5.4 million adults affected by Alzheimer's disease in the United States. Mock 2014 projects that number will rise to somewhere between 11 to 16 million by the year 2050, page 378. Around the world, Korolev 2014 estimates that there is 35 million affected with the disease in the world today, with a projection of numbers increasing to 65 million by the year 2030, page 24. With 1 out of every 9 people over age 65 expected to be affected, dementia carries significant implications for patients, their families, and our society. Korolev 2014, page 24. It is vital that all nurses in any healthcare environment have a complete understanding of the disease. There are several common risk factors that independently don't guarantee a person will develop Alzheimer's disease in their lifetime. The first greatest risk factor is age. As the brain begins to deteriorate and have physiological changes due to age, symptoms of Alzheimer's disease may be noticed first by family members. The Alzheimer's Association states that the risk of developing the disease doubles every 5 years after turning 65 and increases to 50% by the time a person has reached 85 years of age. Family history. The genetic makeup of a patient's family does matter. Head trauma. Dr. Daniel Amen, a renowned neuropsychiatrist, strongly encourages parents not to allow their children to play any contact sport if it could involve any blunt force hit or trauma to the head. His caution is based upon over 20 years of SPECT scans he views when working with patients' behavior. He recommends ping pong as the safest sport in comparison to the head trauma possibility of football and soccer. Not only can it cause head injuries now, but in the future, the risk of dementia increases. Genetic factors. In scientific research, genes are being studied. The risk gene with the strongest influence is called apolipoprotein, E4, or ApoE4. Scientists estimate that ApoE4 may be a factor in 20 to 25% of Alzheimer's cases. Vascular disease. Certain disease processes can increase the chance of Alzheimer's disease. Mock 2014 states that some data indicate that cardiovascular disease risk factors, such as physical inactivity, high cholesterol, diabetes, smoking, and obesity, are associated with increased risks of dementia, page 381. Scientists have learned through studying patients with early onset Alzheimer's disease that an amyloid precursor protein that is normally cleared out of the body, instead, due to age or inflammation, is not cleared and increases, therefore leading to neurotoxic and inflammatory processes on the brain's neurons, causing neurofibrillary tangles to be seen. This is still a work in progress as scientists grapple with studying the physiological effects on the body that often can't be completely diagnosed until autopsy. Cole and Frocci, first published in 2010, stated that whatever their individual contributions are at different ages, inflammation, oxidative stage damage, and protein aggregate accumulation are common features that often occur early and accompany many of the neurodegenerative diseases of aging. Signs and symptoms of Alzheimer's disease are frequent forgetfulness, especially of recent events, difficulty with common tasks, such as cooking, forgetting common words, becoming lost in familiar areas, poor judgment, especially with finances, misplacing objects in unusual places, changes in mood, behavior, and personality, lack of interest or involvement in life's activities, apraxia, which is the inability to carry out motor activities even though physically able, such as combing your hair, agnosia, which is the failure to recognize sensory stimuli. Assessment and diagnostic tools for Alzheimer's disease include a complete physical assessment, which could include a family history, a medication review, a physical assessment, pertinent observations from family members, blood work to check for infections, and abnormal lab values that could indicate another underlying cause. It could include imaging studies such as a CT scan, MRI, or a PET scan. Could also include a SPECT scan. The nurse could perform a mini mental state exam with scoring 30 is considered normal. This test is most popular screening, but less available to the public. Next one could be mini-cog, or it could be the St. Louis University Mental Status Examination. And if a client does poorly on these exams, they would be referred to a qualified neurologist or psychologist. Currently, there is not a cure for Alzheimer's disease. A major shift from costly disease management toward prevention is now mandated because the US and other developed and developing nations with aging populations face projections of unsustainable healthcare costs to pay for the healthcare costs of these populations. Cole and Fritchie, 2010, page 869. Research is being done in every area, including the pathophysiology of the disease, the treatment of Alzheimer's disease, and even prevention. New medications such as Namenda and Aricept are being used with patients with some limited success. Studies and clinical trials are occurring in research centers attempting to understand the significant role that inflammation and oxidative stress has upon the aging brain, noting the possible preventative effects of anti-inflammatory agents such as DHA and omega-3 fatty acids, how diet can play a role, and noting what other comorbidities can increase the risk of this disease. For families facing the new diagnosis of Alzheimer's disease in a loved one, the task of dealing with the disease and its effects on life over a long period can be daunting. Neurodegenerative diseases represent major unmet challenges for therapeutic intervention. Thomas, Radcliffe, and Itsiopoulos, 2015, Part 3.1. Nurses can be responsible for learning all they can to be known about the disease, educate others about the disease, and show compassionate support and offer hope for those that feel they have no hope. Alois Alzheimer seemed to understand that when he said, "Excessive reservations and a paralyzing despondency have not helped the sciences to advance, nor are they helping them to advance, but a healthy optimism that cheerfully searches for new ways to understand as it is convinced that it will be possible to find them."